First stop, 680 News is CMTR in Toronto. It's 1 o'clock.
For breaking news, traffic, and weather, this is 680 News, Toronto.
Here are Steve Roberts and Sarah Barrett.
Well, good afternoon. This is Monday, the 18th of January.
Here's what's making news this hour. Premier is expected to announce a dedicated pandemic hospital. This as Ontario sees one of the smallest daily increases of COVID-19 so far this month.
The city of Toronto's first ever COVID vaccination clinic is up and running. How was the process? Quick and easy. Yeah. Okay. Frontline workers are getting their shots at the Metro Toronto Convention Centre. Toronto's Board of Health passes a motion to ask the province to implement paid sick days for frontline workers.
So I demand to see paid sick leave now
in an effort to limit the spread of COVID-19. As we wait for the Trudeau government to respond to the upcoming U.S. cancellation of the Keystone XL pipeline, I'm divided over whether the Fed should accept or fight the decision.
Nova Scotia.
Wins with the Jets in town. Raptors home to the Mavericks. 14-15.
60 seconds.
Here with U.S. markets closed and shares in TC Energy still in the red. Closed for the day. Business at 26. 680 next time. 101.
I got time for traffic and weather together.
Realize, looking at my own face, it's going to be the soonest I notice that it's not what I believe it's going to be. If this goes this way, but on the screen it goes that way. So within 60 seconds, this shit gets So, Nova Scotia today implements presumed consent. What the fuck is this? The company you might be calling you the same
awesome shit, talk shit, get hit, big bump, I mean, let's
leave, let the front
just like a dick, I'm in, there's no slick, Saint Nick, she want my dick, she knows I'm sick,
Canadian media is too racist
if I get is lit, if you talking shit, fuck is clicking, fuck is gango, hit the three, just like I'm dang.
So Nova Scotia implements presumed consent today. You are presumed to have consented to organ donation unless they say you did.
And this might put you getting late. I'm in the trap, the cops that are late. I got that work, you know they great.
Any second now, they're gonna switch over to the very first hospital ever for a pandemic. China built it a year ago. We've done this before.
Hit it with a slug, go make a move slow. You know me, I'm a
Hey, Mr. Dines, you know how obvious it is when you
flow. They love my beat, they rate my flow. My neck is cold, it's true below. They just gon' shoot you. Know I drove you, keep my heat. I ain't it's go. I'm in a trap,
something. You've been telling us for 7 hours. How you're gonna get subscribed to that?
Cheerios reporting 2,578 new cases of COVID-19 today. 24 more deaths linked to the virus. It's the lowest daily increase in new cases since January 1st and the lowest deaths so far this holiday
Since January 1st.
Patients remain high at almost 1600. About a quarter of those people are in the ICU. Hospitals are having capacity issues, but health is on the way. The new Bomb Hospital is to open next month as a regular hospital. But the Global facility will now become a dedicated pandemic hospital. The Premier has announced
So it would have relieved the strain on the healthcare system, but now it won't. So COVID patients in ICU cannot be moved. What you should be noted. You've been telling us for 3 days that it's all about the general public.
That's right, Steve. This is the first day of the process that should see over 5,000 City of Toronto frontline workers getting their COVID vaccination. And this man who works in the shelter system was one of the first. How was the process? Like anything, yeah. Okay, nothing. Why is it that you want to get the shot today?
Mainly see my family and basically feel safer up being around.
City of Toronto staff are found to be responsible for bed bugs, tuberculosis, scabies, all that being spread to the whole city. So when you say there's a bed bug epidemic around the world, and there is,
as people come and go by a side door,
it started here.
Convention Center.
It started here. They keep breeding shit. They breed bad things.
It's really critical the success of this clinic is because it's a proof of concept clinic. It's going to be a model for how all future city-run clinics in Ontario will be held.
We are looking at not
If
only
it proves
the design,
concept.
the setup, and the operation, but all of the technology, all of the registration, everything to do with clinic operations from
technology.
one end to
You realize they're not supposed to be keeping track of your medical information.
Now, this
that way?
clinic is aiming to vaccinate 250 frontline workers per day with the Moderna shot. But this clinic was also designed to be able to be
still at
scaled up
5,000.
so that when the time comes for general vaccinations for the for mass population, this facility here will be able to handle it, and that's one of the reasons it was set up right here
In
at such a large
3,000 weeks, they can do the whole
Toronto
city.
Convention
Wow,
Center.
you guys are
Reporting
good.
live on
You guys are good.
I'm Mark
3,000
Tucker.
weeks, that's it.
Abolishing the province for paid sick leave was on the agenda for today's Toronto Board of Health meeting. 680's Momin Qureshi followed along and joins us live with the latest. Momin.
Yeah, the meeting has now been adjourned, and they have indeed passed that motion recommendation, well, several recommendations really, to ask the province to implement those 10 paid sick days for frontline workers. Councillor Christian Wong-Tam says it's absolutely necessary.
80 to 90% of individuals who are low-income workers do not have access to paid sick leave.
Do not have
We are
access
not
to.
going to be able to beat this pandemic. We are not going to be able to get in front of
You realize the law already
until
covers
we
sick
address
days,
this
right?
very critical and very important policy gap.
Now, the idea here is to create those 10 paid sick days for frontline workers, people maybe who
Why
work
are
in
you
frontline
telling us what
jobs,
the idea
where they
is after
literally
running her
cannot afford to
soundbite?
take any time off.
She was
because it
telling
means
us what the idea
putting
was.
food on the table, paying rent, or staying at home and taking care of yourself. And the concern there is that if somebody has
I
symptoms,
liked you better
they
when
will
you were
choose to
talking
go to
about
work
domestic
instead of stay
terrorists, the
home,
white
and
domestic
thereby could
terrorists.
lead to the spread potentially of COVID-19. So if these sick days were created, it would give people an option to stay home with pay. The Premier is speaking
So
in
how's
just a
that
few
help
minutes.
the other
We'll carry it
people in their
live here,
house
and
who
we'll
still
see
have to
if
work?
that issue is addressed. Reporting live, I'm
The other
Momin
people don't
Qureshi.
get sick days.
Well, anxiety certainly high in Washington right now as tight security is in place for Wednesday's inauguration. As ABC's Alex Stone tells us, though, there was a bit of a scare this morning at the Capitol. This was the overhead warning playing at the Capitol, telling everyone to take shelter and to stay away from windows. President-elect Biden's inaugural escort was on site for an inauguration rehearsal, and they were moved under the Senate carriage entrance. It turned out it was a fire at a homeless encampment under an overpass, and there was some popping or explosion noises. There was no threat to the Capitol. Alex Stone, ABC News, Washington.
The Trudeau government now weighing in on the plan from President-elect Biden to cancel the Keystone
So
XL
homeless
pipeline
encampments
as one of his
are not
first orders
a
of
threat
business when he takes office.
to the
With more,
administration
here's
of
our
government.
Parliament's Hill reporter,
Remember
Cormac McSweeney.
Just moments ago, I received a statement from
Yes.
Natural Resources
John Thorne
Minister
says they
Seamus
are.
O'Regan, which says the Trudeau government's support for the Keystone XL pipeline is long-standing and well-known, and they'll continue to make the case for it with the U.S.
Remember a
administration.
year
The state
ago, they were
argues the pipeline is under strong environmental policies, strengthens the Canada-U.S. energy relationship, and creates thousands of jobs for both countries. This comes as conservatives across the country call on the Prime Minister to do all he can to stop the President-elect from making this move. They argue
You don't
that
have
the
to hire
pipeline is
guys
of
to
national
stand there and look at
significance.
the
Alberta
pipe,
Premier
right?
Jason Kenney
Look at
even
that
says
oil go.
he's considering
Look,
his government's legal options.
We believe that we would have very strong arguments for legal recourse for damages incurred.
But the Greens and NDP are praising Biden for climate leadership if he cancels the project. The New Democrat leader Jagmeet
Who are
Singh
you gonna
says
sue?
Trudeau has
Stupid?
failed energy workers in the transition to the green economy.
We have a responsibility to workers here in Canada, workers who've gone through bust and boom times, that we make investments that create long-term jobs for them.
Cormac McSweeney, Parliament Hill. And on the
We
way in
owe
just
it to
30
people who
seconds,
were
check on the
offered
price
a
of gas.
6-month contract assembling the pipe
RRSP season
to
is
have a
here.
long-term
Consider
job
Israel
and
bonds for
buy
your
100
RRSP.
hundreds
Tax-free
more
savings
times
account.
more.
Israel bonds are now paying up to 3.14%
That
in
makes a lot of
Canadian
sense,
dollars,
bro.
subject to conditions. Israel bonds are sold in Canada by Canada Israel Securities Limited. Diversify your RRSP and TFSA with Israel bonds. Rates up to 3.14% are available until January 31st. Call Israel Bonds today
I got
at
a better way to cook up a fire.
416-789-3351 or visit israelbonds.ca.
And now time for the 680 News gas price update. Enpro says no change at midnight tonight. Should hold at $1.11.9
It's
a
completely
liter.
false economics.
680 News Time, 110.
Where's their income come from?
City TV.
Exactly.
Allow us to introduce you to your brand
So
new
why are we
bachelor,
paying
Matt
taxes to
James.
pay them money? Give us back a little bit, but
Is the delicious man?
Matt will lay it all on the line for his shot at love.
The reason I came out here was to find my wife.
But it's going to be a fight to find Mrs. Right.
The queen has arrived. Be wary of this girl. What is it? It's not okay.
The Bachelor, Mondays 8/7 Central on City TV. Stream live and free at citytv.com.
Hi, I'm Sherry Tabb, co-founder of the Herzig Eye Institute. Covered by a mask, unable to touch, never needed our eyes more. To see and breathe, but also to smile, connect, to take the place of a hug. Won't let glasses, contacts, and cataracts get in the way. Stay on your head and come to Herzig. Google Herzig Eye Institute. Call us for a consultation. There's no charge. Herzig is prepared. You're protected. Look after yourself. Honestly. City News Time, 111.
Time now for traffic and weather.
Well, the heaviest route right now is the northbound 427. It gets jammed at the top and into the long-term construction area. That backup starts at the 407 and it's slow going right onto the ramp to Highway 7. We still have a stalled vehicle eastbound on the QEW on the ramp to Trafalgar. The right lane blocked there, but there's no delay heading past this problem. And great news, that issue eastbound 401 at James Snow Parkway, that's cleared away. Delays have eased. And westbound on the 401, just got word from the MTO, the problem on the ramp to Fixham has cleared away as well. So we're in great shape on the 401 in both directions. The Don Valley Parkway, that's moving pretty well both ways. And the Gardner lightly traveled into and out of downtown. On city streets at Finch and Dufferin, the traffic lights are out at that intersection. Police are there on point duty. Hydro crews on scene as well. Delays aren't too bad there. Northbound Military Trail past Old Kingston Road at Bogmar. All lanes are blocked. That's due to a sinkhole. But drivers are using one of the southbound lanes to get around. Your next traffic report is at 1:21. Now with the forecast, here's Jill Taylor.
We'll have varying amounts of sun and cloud today. A few flurries possible. Could
You mean the
intensify
MTO
for parts of the GTA, mainly the west end through the evening. Guaranteed high 1, -2 for the low. Tomorrow, mainly cloudy, and again, a chance of flurries with a high 0. For today, the guaranteed high +1. Mostly cloudy sky in downtown Toronto. It is 1 degree. Over at Pearson Airport, also mostly cloudy and 1.
You want to see how this country treats the Army? Go check the housing and military trail,
Let's check
and
in
then
the
down
business center.
on
Everything's looking crisp.
Well, we do
Queensway
have
or
a modest
Lakeshore,
gain
down
on
in
Bay Street,
Rex,
Steve. It's up
Etobicoke, I should say.
by 30 points, 17,939.
The
No
military
direction
housing and
coming
the
from Wall
post-war
Street. It
houses.
is closed for Martin Luther
Post-war
King Jr.
houses.
Day, so commodities are trading electronically. Right now, gold is higher by $7,
always do.
$18.36. Oil going the other way, down 27 cents, $52.09 a barrel. That's
We have
a drop
no
right now
understanding
of
of what it is
about
they
0.5%. And the Canadian dollar down by 15,100, 78.36 cents US. At the Business Center, I'm Chris McCusker.
When it comes to investing, it's time to consider the alternatives. Dynamic
guarantee
funds
you
sees
get stuff
diversification
before.
differently. Ask a financial advisor how and learn more at dynamic.ca/advice.
It's time to rethink what rest means. In fact, it's time to take sleep not just a little, but a lot more seriously. And Casper is here to help. With Casper,
Cruising down the street with my AR, stacking it with. We all trying to score. Better get low, cause we flip cars. Right hand of 10, we seen it from 4. Cruising down the street with my AR, stacking it with. We all trying to score.
I don't know where these guys got it from, but it reminds me of
strap out of 10.
Black Power in New Zealand and the Mongol.
When I come through, them niggas know how bees do. All they heard was some loud shots when the cop came, gave no clues. I put it work, but that's never work. And I put it work, that top flip. Came like Bruce Lee, go kick back.
Hospitals. We are waiting to go live to the
We are hearing that something new is coming. Is this why did you give this guy different lines than everybody else?
Dedicated to administering
Pretending there's
COVID
something
vaccines now open at the Metro Toronto Convention Center.
Everybody else knows what it is, but it's something's coming.
It is going to be for City of Toronto homeless workers, homeless shelter workers right now, at least for the time being. And coming up after sports, Canada's entrepreneurs are fairly optimistic about 2021. Details on that just on
Worst humans on the planet. Look at Toronto's homeless shelter system.
First, that was time for 680 Sports. And from Sportsnet 590 to Fan, here's Andrew Nye. Steve
I fuck this nigga to pass it to the class. He pound so we can got the sass. No conversation, never chasing mass. Hey,
collision estimated time of reopening. 401 problems on the westbound side. It was on the ramp to fix it. We were dealing with the stall. It was in the right lane. It did all clear. And Toronto on the Kimmy Deli. This is on the ramp to Trafalgar, right lane out with the stall. If you are headed towards the Gardner westbound,
she's still working. Dean Blondell is
out of the downtown core. News Talk at 10:10 weather. We will see some flurries tonight, up to 2 centimeters expected. Temperatures dipping down to a low of -3. The wind chill will make it feel like -9. Right now, we're currently sitting at a very cloudy 1 degree. Take comfort knowing that the CPP fund will be there. CPP Investments helps to ensure the CPP fund remains sustainable and secure for millions of Canadians. Visit cppinvestments.com. I'm Angela and Tia Yabua. Your next update at 1:30, where Toronto gets answers.
Because I can only imagine how small businesses are feeling after seeing this news after the weekend.
Yeah, because
there has to be, you know, the mom and pop shop, the, I don't know, shoe store that's saying to themselves, oh, you know what, we could let 3 people in just fine, thank you. They could be distanced. We can make sure those 3 people have got their masks on, and we can still be open and making a living. Yet here we go again with the big box stores open, not only allowed to be open, but a third of them approximately not following the rules and the regulations. So, you know, you can hear from small business now that, you know, Mary, they're going to be, I would think, justifiably upset because, you know, fewer people in their stores.
樂壇走勢咧，就全部基本。
air particles ਨੂੰ trap ਕਰਕੇ coronavirus cold influenza ਵਰਗੇ bacteria ਤੇ virus ਨੂੰ inactive ਕਰਦੀ ਹੈ. Starting from as low as $16 per month and 10 years warranty. For clean and healthy air, call 647-300-3573 or visit lghomecomfort.ca.
See, they know how to do this.
IPTV box में garbage गाड़ी दे लो वीडियो लेके आया है फट्टे चक IPTV box भाई बेस्ट क्वालिटी वाला IPTV box ते नाले फट्टे चक हाई डेफिनेशन टीवी प्रोग्राम एंजॉय कर सकते हो लाइव हिंदी पंजाबी चैनल भी देख सकते हो ते नाले ब्लू-ray HD क्वालिटी बॉलीवुड फिल्म भी एंजॉय KO 咗啦今年我未出過係因為啲冰咧得仲因為佢可以去
It impacts those small shops, and they can manage it. It's a small place, you know, one person in, one person out. It's that easy.
Absolutely, but they've been closed, as we know, for some time under the restrictions, the lockdown, and now, of course, the stay-at-home order. By the way, we might hear from the Premier on this. We're going to hear from Dan Kelly, as I mentioned, from the Canadian Federation of Independent Business in our next hour on this. I'm wondering if the Premier will address this. Is he up there, Robbie? Okay. The Premier addressing everybody in Vaughan.
It's a rare of hope, and for all of our incredible healthcare heroes in the front lines of this fight. With many of our hospitals, you need every tool possible. You need to mobilize every resource. All those heroes who are stretched to the limit right now. That's because working with ALLDAY and his team, I have to tell you, ALLDAY is an absolute champion.
Which one's
will open its doors? It's the first newly built hospital in Ontario in over 30 years, adding net new capacity to the system. And when we're in the fight of our lives, this incredible state-of-the-art hospital.
They're going to ask you how many hospitals got canceled by conservative provincial governments.
It's a rare of hope. And
a rare of hope.
Entire team at Mackenzie Health for stepping up to the plate at this time.
One of them has about
ICUs approaching full capacity or beyond. This new hospital, it's relief. It's added capacity for all those heroes who are stretched to the limit right now.
Whoa.
Working with ALLDAY and his team, I have to tell you, ALLDAY is an absolute champion. This guy has hit the ball out of the park, and I told him today that ball's still going for stepping up like this.
You realize it's a reference to Toronto Exhibition Stadium, where you actually could do that, because you can't do that at Skydome.
Leadership here in Vaughan and all of their work getting this hospital off the ground. And above all, I want to thank all of the frontline workers, the nurses, the PSWs, the doctors, for stepping up to the plate at this time. Heroes have been working around the clock to provide top-notch patient care over the past few months. My friends, this is Canada's very first smart hospital. It's a spectacular addition to Ontario's healthcare system, and we can't stop here. We're investing $18 billion over the next 10 years to build new hospitals right across Ontario. But my friends, the fight isn't over yet. And as I've said before, we will be here. We will do whatever it takes. We will spare no expense to keep you and your family safe. Thank you, and God bless the people of Ontario. Now I'll hand it over to all of the frontline workers, the nurses, the PSWs, the doctors, paramedics, and hospital staff at Mackenzie Health. These local heroes have been working around the clock to provide top-notch patient care over the past few months. My friends, this is Canada's very first
of more than 3,100 new beds in hospitals and alternate health facilities across the province. And today, we are pleased to announce that we are providing $125 million to add over 500 critical care beds to hospitals in hotspot regions.
How many beds are in this hospital?
We're working with Ontario Health to select these hospitals.
We will spare no expense to keep you and your family safe. Thank you, and God bless the people of Ontario. Now I'll hand it over.
All right, there's the premier this afternoon.
At the request of the province, the Corporal Chief Vaughan Hospital will temporarily transition into a system-wide resource supporting the province's COVID-19 response when the new hospital opens next month.
What hospital isn't a health system-wide resource?
The Corporal Chief Vaughan Hospital will provide a total of 185 additional beds, including over 35 critical care beds and 150 general medicine beds to support non-critical patients from other hospitals. Currently operated services will remain at the Mackenzie Richmond Hill Hospital site. Once COVID-19 capacity pressures have stabilized, the new hospital will fully open as originally planned to provide care and services to patients from across the Western York region. We're also amending the necessary regulations to allow hospitals to temporarily redeploy staff to other hospitals or retirement homes that urgently need additional support. We previously made this change, allowing hospital staff to work in long-term care homes. These steps will help to alleviate capacity pressures being faced by hospitals, allowing our healthcare system to work more seamlessly and effectively to keep Ontarians safe. We will continue to work together with all our hospitals and healthcare partners to care and protect everyone affected by this deadly virus. Again, until vaccines are widely available, I strongly urge everyone to only go out if absolutely necessary. If you can't work from home, to get groceries, pick up a prescription, or attend a medical appointment. Please also continue following the public health measures and stay home, stay safe, and save lives. Thank you. And now I'd like to invite Altaf Skeshenwala, President and CEO of Mackenzie Health, to the podium.
Thank you, Minister Elliott. Corporal Chief Vaughan Hospital opens in a few short weeks. It was always intended to be a tangible solution to ending hallway medicine. COVID-19 cases are rising at an alarming rate.
No, we're supposed to be crammed in the rooms
Hospitals have reached their capacity limits and are forced to transfer patients.
I can't count the number of white people. I've had to sleep in a room.
Now more than ever, we're proud to support the greater healthcare system.
Because they don't go back, it destroys our
focus will be on creating ICU and acute care capacity to support the COVID crisis and hospitals across the GTA. The emergency department will not open until the COVID surge has been addressed. Our emergency department at Mackenzie Richmond Hill Hospital remains open to support our community as it
That
always
has been
has.
addressed. You just said you addressed
Once the
it.
system is stabilized, Mackenzie Health will fully realize our 2-hospital future. This is a
now you
different
own
opening
2 hospitals.
than we
That's a
committed to
shitload
our
of money to
staff,
ask province
physicians,
for.
and community. But we know it's the right thing to do for our community and our province. I want to thank our government, our staff, physicians, and volunteers,
You realize how
donors,
unhealthy your voice
partners,
sounds?
and the broader
You
community.
got something wrong with
We've
your
all
throat,
worked
right?
so hard to make Cordalucci Vaughan Hospital a reality. Thank you.
You've been
I
hawking
would
those
now like to
whippets,
invite
haven't you?
Vaughan Mayor Mauricio Bevilacqua to the podium. He's also the chair of our $250 million Ultimate campaign. Mr. Mayor?
Mayor Vaughan. Call Mr. Mayor because
Thank
don't
you,
know the name.
Altaf. COVID-19 is a marathon, not a sprint. Patience, discipline, and perseverance are required to defeat COVID-19.
Patience are required.
In this journey, we must continue to
Patience?
share the common
You said
purpose
patient.
and pull our resources
You
together.
enunciated the
And this
T,
is
bro.
precisely what we are
Jesus
doing
Christ,
here
these people
in
are
the city of Vaughan today. The Cordalucci Vaughan Hospital will open its doors in a few short weeks and address the critical
I think
need
the
for
most life-threatening
ICU beds
situations I've ever
in this
had were in
province
hospitals.
when the
You know what
need
these idiots-
is greatest. The city of Vaughan remains committed to working together with the province, public health officials, and citizens to stop the spread, save lives.
You're the same idiots that
And
told me
protect
you don't care
our
about
hospital's
people's
capacity.
physical health. My mental health
Premier,
is more important.
I want to
Right.
express my gratitude to you
I'm dying,
cabinet
but it's
and your
okay
team
because you're going to
for
fix my
addressing the
brain.
evolving challenges
By
facing
convincing me I said
Ontarians
things I didn't
since
say.
the
because You
onset
told me you
of
made
this
them up.
global
Right,
pandemic.
Dr. Ahmed?
By working together, using our intelligence, common sense, and by exercising personal responsibility for the greater public good, we will emerge stronger.
So that last part said,
At this time, I would like to
in
invite
charge of deciding
The
what you're
Honorable
allowed
Stephen
to do and
Lecce,
not
Minister
do.
of Education and the MPP for King Vaughan, to the podium. Minister?
What minister is this?
Good afternoon, and thank you, Mayor, for the introduction. Now, throughout this pandemic, when our province faced incredible difficulties, it was our community that stepped up to produce the first Made in Ontario PPE. We stepped up to donate generously to programs that support the most vulnerable right across the GTA.
Yeah, so did
And today,
GM Oshawa.
when faced with this invisible threat afflicting the
Actually,
entire
GM
world,
Oshawa did it
it is
first,
our
and that's
community,
why
our
3M
families and
supposed to be
citizens
opening a
banding
mass
together
factory,
to ensure we
a
can
week
defeat
ago.
this disease. It is Vaughan stepping up yet again to help save lives with the opening of the Cordalucci Vaughan Hospital that will support a system-wide and regional response to combating COVID-19.
Did you pick a name
As the
we can
Premier noted,
spell?
185 additional beds, 35 critical care beds, 150 general medicine beds, all opening for February 7th. All to help those among us, our parents and brothers or sisters, our grandparents and our neighbors who contract this disease to get the best care possible, exceptional care in a state-of-the-art hospital. I want to thank every frontline worker and the hospital administration, the Cordalucci Vaughan Hospital, and Mackenzie Hospital. Thank you to the city for your partnership, to our Premier, Minister of Health, for your personal commitment to delivering this critical hospital to our community. And thank you, most especially to the people of Vaughan, for always stepping up and for standing up. We represent the very best of our country and the Ontario spirit that inspires us to continue to work hard and together, so we will defeat this disease. And now I want to call back up the Premier to answer questions. Thank you.
We'll go to the phone line for questions.
The
First
disease
question,
is
please.
people won't stop spitting in people's faces, refusing to acknowledge physics and math and everything.
I want to ask, I know you expressed frustration, obviously, in the last several, the vaccine issue, the supply crunch, but I understand because of that, the province is now saying that there are no more first doses for anyone outside of long-term care homes or high-risk retirement homes for the time being.
And there won't be any until you use up the second dose, but you said you're not, like, you fucked this up. You fucked this up royally.
Who now are just finding out that they're not going to be getting their shots anytime soon.
Well, we're working and doing everything
First
we
one's
can with
free,
federal
dumbass.
government to work with Pfizer to get the
You're gonna
vaccines
work with
that we need.
Pfizer by
It's
refusing to
absolutely
follow their
critical. I
directions, so
understand
that's why they
their
cut you
concerns.
off.
Right now, we're working in conjunction and collaboration with the federal government. And so I guess someone's going to have to, as I asked the Prime Minister when we can expect it. And I have all the confidence in the world in the Prime Minister working his back off with Pfizer to get this done. We still have the Moderna, and I will pass this over to the Minister of Health to follow up.
The Prime Minister said you're supposed to be making decisions based on science.
We are doing everything that we can to work with the federal government to receive more supplies, but the fact is that Pfizer is doing some retooling at their plant in Belgium, and so we will see our supplies reduced for a period of time. However, we know that we need to protect our most vulnerable citizens, our residents of long-term care homes and high-risk retirement homes. This is a pledge that we made to them
the second dose at 6 weeks instead of 3, so they said they're not sending you anymore.
And then, of course, our healthcare workers are also very important in those locations and in hospital locations. So as soon as we have those vaccines, that's where they're going to go.
Did you hear the news out of Norway? All those people you're giving the vaccine to are the ones that are going to die.
The 500 new critical care beds. I don't know if the Premier or Minister of Health would like to answer this, or both of you. The question is, when can we realistically expect those beds to be in operation? I assume it includes the 35 that we're going to have in a couple of weeks, right where you guys are. But you've got to find staff and space. If that's going to take weeks, months, how long will it be before all 500 of those beds are up?
Before I send it to the Minister of Health and over to ALLDAY, I'm going to give ALLDAY another shout out. You know, and the people of Vaughan and the mayor, they have, gone above and beyond the Call of Duty. And you've heard me many times call it the
using those catchphrases,
and Sunnybrook and everyone else. But this is a massive call out for the people of Vaughan. Thank you for stepping up. You're making a difference right across Ontario. And I'll never forget, I called ALLDAY, I think a week or 2 weeks ago. How are things? How's the hospital coming along? And he was speaking with Ontario Health, working with the minister's office. I'm sure the mayor.
Hospital
and he said, we're going to be there to support you. And as I say, a lot of hospitals and CEOs have knocked it out of the park. ALLDAY, you've knocked it out of the park, and as I told him earlier, and I said it earlier, but that ball's still going. This is going to make a massive difference with capacity. So again, I want to thank ALLDAY, his whole team, for allowing us to be here today.
How are you going to do that? How are you going to transport people there?
State of the art. It's just unbelievable. First smart hospital anywhere in the country.
No, it's not.
The technology is staggering.
Are you on fucking drugs?
A staff member, they sanitize their hands. It automatically reads the badge, and it will show what person walked in the room and who sanitized their hands. It's just absolutely incredible. I'll pass it over to the Minister of Health. And then
I walk in the room. I walk out, you sanitize your hands, it says I did it.
Well, the reality is we don't have months to wait for these beds to come online, because this is a serious capacity challenge that our hospitals in Ontario are experiencing right now. Even today, we have people who are being transferred from hospitals in Toronto to Kingston and to Niagara. So this is not something that can continue for a long period of time. So what we are looking at doing, in addition to great facilities here at Cordelouche-Lawn, is looking at space that other hospitals already have in their physical premises, spaces that haven't been used for beds for a period of time. We want to open beds up there because the premises are already there, and they have the facilities to be able to open critical care beds. We're also looking at creating step-down units for people that don't need to be in a critical care bed. They can be at a step lower. We can create those in other hospitals. And we're also looking at hospitals that are perhaps rehabilitation hospitals or do other work normally, but they also have the ability to create some critical care beds. So we're looking everywhere that we can within the entire system, particularly in the hotspots, to create those beds. But the units that are opening up here at Cordelouche-Vaughan, the 35 critical care beds here and the 150 medicine beds, are going to make a significant difference.
How do you disinfect a striker bed?
So thank you, Mr. Elliott. Obviously, we can continue to add capacity at this hospital. So as an example, we're not opening the emergency department because we have the ability to create another 24 ICU beds in that emergency department. Obviously, we continue to look for staffing, we continue to recruit. And what I would say, I've never in my entire sort of career as a healthcare leader seen the system come together as it has in the last number of months, in the last year and a half. With this IMS structure that moves patients across the region, we actually come together as hospitals so that we can share the crisis and share the capacity challenges. So it is quite remarkable how all the CEOs and all the hospitals are working together to level load capacity.
Yeah, a shitload of
work
people
together
making $10 million
as Team
a
Ontario.
year each.
And
That's
obviously, this is
incredible.
another addition of
They
capacity
have the spare
that will help the
time
GTA.
Next
to
question.
return
From Lucas Meyer,
emails to their
Wisconsin.
assistants.
Thank you
Email
very
return.
much. So just to follow up on Jeff's question, so what is the earliest we will see these critical care beds come online? And Minister Elliott, maybe you can address this. What does this mean for, maybe getting to, things like field hospitals that it's going to take, however long it's going to take for these hundreds of beds to come online? How many field hospitals are those outside facilities?
And this right here is where I see you people that got enrolled into the over-the-table army, the official
Well, no,
army.
we're looking at adding
You're
capacity
useless.
as
You're all
soon as we
useless.
can,
You got
and
a
in some of the
paycheck, now you're
hospitals, they may
useless.
be able to open
We're
those
gonna get a
critical care
mortgage
beds
and buy a
very
house.
quickly
You
because
missed
they
the
already
point,
have the facilities to be able to do that. It may have been space that has been closed off for a period of time, that they can open that up. Every single additional critical care
Joseph's
bed is
Hospital
going to
has
make a
an entire
difference.
floor.
We've got 35 beds opening up here at Cordalucci Vaughan on February 7th, and we have been in discussions with the federal
They spent
government for
$10 million on the
field
site. It's always
hospitals
$10
as well,
million on
to be able
renovating
to
the
move
psych
people
ward.
who
We don't
might
get
not need
nothing.
to be in a critical care bed
Shitloads of
to
work
be
for a
in
year,
another
but nothing.
location. So there's a lot of shifting and
That's
movement
why
that
the other
needs to
floor, the
happen,
fourth floor
as
is
well
also
as dealing with all of the health human resources, which is another one of our biggest impediments. So
all
that's why
storage.
we're looking at redeploying
All
trained
the crap
staff
they need to do
from other
renovations.
hospitals in non-COVID related areas into the hotspots. So we need all hands on deck. There are 1,000 moving parts in all of this, but it's all happening very, very quickly.
You need a
because we know
hospital for
that the
people
need
that
is
don't
great
have
and it's
COVID, you
significant.
fucking idiot.
Follow up?
Well, and if you could also address, Minister, what we should expect in terms of those outside, field hospitals, resources, if you could elaborate on that. But also, Toronto's Chief Medical Officer of Health, Dr. Arlene DeVilla, mentioned today that because of the Pfizer delay, that can mean a 20 to 80% reduction in the delivery of vaccines in the city. Are you seeing that as well? And do you expect that to be across the province as well, not just Toronto, but 20 to 80% across the province as well?
Well, first of all, dealing with the question about the field hospitals, they are coming online. We are working with the federal government to get them operational. That shouldn't take very long to happen at all because we know that the need is great. It's urgent. So we're working with all hands on deck to get that moving forward.
This province,
with respect to the
any
Pfizer
equipment you could
shipments, we
possibly
know
think
that
of,
the
you can
next
rent from
two
somebody.
shipments, one is going to be 20%
the
less.
generator,
The shipment after
from this
that will
big
be
to the size of a
80%
transport trailer.
of fewer vaccines, but those are until we get into the month of March, very early on, late February, early March, we're going to be receiving larger doses of vaccines coming in. So this is a very temporary situation. It has to do with the amount that we receive from Pfizer through the federal government. This will affect across the province shipments and receipt of vaccines. Next question.
Crawley, CBC
If I had a pound of weed and said, I got joints here.
Hi, I heard Minister Elliott, our Premier, or perhaps Mr. Stishwell, could clarify the 185 beds at the hospital. I don't actually see in the news release that it says that they're dedicated specifically to COVID patients. Could you clarify whether you're taking all patients in? Because there seems to have been a message that this is as a dedicated hospital for the pandemic response. It seemed to give us an impression that it's only going to be for patients
Sure, I was
who are
prepared for this because I knew someone would ask
Could you please clarify that?
Sure, good question, Mike. I'll pass to the minister and over to Altaf too.
Who?
Well, there will be 35 critical care beds opening here at Cordalucci Vaughan and 150 medicine beds. But the idea is that this hospital is going to be used, as Mr. Seshamwala has said, in order to be able to help take the load off some of the other hospitals that are experiencing
that will happen
challenges.
naturally.
And I'll ask
That's
Mr. Seshamwala to come and speak to that specifically.
When did you start building this hospital?
So thank you, Minister Elliott. So what is important about the model that we suggested, as you know, we're not opening the emergency department, to create more physical capacity, but also to ensure that the key intake for this hospital continues to be the IMS structure that's been put in place across the province. This is a structure that's led by Dr. Andrew Baker from St. Michael's Hospital, and it ensures that the level loading across the GTA, which is the most challenged, will continue to be the sole source of intake for this hospital. So we're dedicated to supporting the hospitals around us as they see more capacity challenges to level load case volume across the GTA.
The GTHA, or the Toronto census area? Which one do you mean? You're going to take all people from Richmond Hill and Vaughan. You just said so.
Simple question: is it or is it not for COVID only patients? But I have to ask another
all
question.
The white people that live in Richmond Hill,
my colleagues,
Vaughan,
seniors who are not living in long-term care make up a significant portion of the people who died in Ontario from and yet they're not is one of the government's rollout. Could you justification for why seniors who are not living in care are not one of these priority groups, and explain why they're not further towards the front of the line?
Well, as we've said right from the beginning, Mike, we're taking care of all long-term care patients in the hot zones and the staff as well. And then we have to take care of the frontline healthcare workers as well, move it across the province. But make no mistake about it, our seniors are a priority. They're the ones that built this province, built this country. And I believe the general is with them when he would answer this question before. They're going to break it down to age. I guess start with 90, then down to 85 or 80, and so on and so forth. But I'll pass it to the Minister of Health. Thank you.
Well, all of our seniors are very important, whether they're in long-term care homes or retirement homes or whether they still live at home. But the reality is we've had a surge in cases in our long-term care homes. We've had many people tragically pass away. And so we know that they are required to live in relatively close quarters. That's one of the ways that this gets spread, and they have people coming in to see them that bring it in. It doesn't just happen. It's brought into them. So they don't have the ability to stay at home and stay safe if they live alone, with some people bringing them food and medication, as some of our other seniors do. That's why we've targeted this group of seniors in long-term care homes and high-risk retirement homes, first of all. But everyone is important, and as the Premier said, once we start receiving a larger supply of vaccines, we are then going to be moving to adults who have home care requirements, and also starting with adults that are 80 years and over, and then moving it down in 5-year increments. So everyone is important, but it's just related to the supply of vaccines right now.
Look at the demographics of how many people are in each age group. Going by 5-year increments is arbitrary.
Thank you, Sean.
Oh, hi, everyone. I think I want to try and get a bit of clarification on Mike Crowley's question there. So it sounds as if patients who are going to be coming to the hospital in Vaughan are not just going to be COVID patients, but they're going to be patients who have to be transferred because of capacity issues generally because of the pandemic. Is that correct?
I'll pass that over to the Minister of Health, or I'll pass either one.
The IMS structure is moving COVID, GIM, and ICU patients exclusively over the last number of weeks. So that would be the type of patient that comes to Court-Louis-Vaughan Hospital. Over the last number of weeks, the exclusive movement has been ICU patients. So based on how that modeling works and based on how that table moves patients around, that will dictate, the kinds of patients we receive.
Yeah, people in car collisions, people with workplace incidents. People get stabbed and shot. Where's COVID coming today?
Previous board, I wanted to ask you about a recommendation that the Toronto Board of Health made today about paid sick days. Now, I know you've been asked about this a number of times over the course of the pandemic. I'm trying to understand why your government seems resistant to, giving more paid, especially when, this would help workers stay
Every time they don't like the question, it cuts out.
Can't afford to otherwise, which would then, help break, alleviate workplace outbreaks in the system. So why not give
20% of kids in school-age kids tested positive, and that's why we're forcing the schools to stay open.
Restart program with the federal government
because it disproportionately affects nigger kids.
$7.1 billion, only $270 million has been taking out of that. So
Hey, that presumed consent for organ donation will disproportionately affect those who are more likely to die. Black people, natives, anybody that's a visible minority.
If people don't feel they're getting it quick enough,
Anybody
which
who's
is brought
poor.
to the attention of the Prime Minister and Deputy Prime Minister, then we need to change the program. If they need to top it up a little more because $500 a week isn't feasible, then we change it. But let's be very, very clear. There's no reason for the province to jump in there when less than 27% of the overall program hasn't been taken up. Does it need to be changed? Sure, it needs to be changed, and we're working with the federal government, but there's no reason for us to duplicate the $1.1 billion with the federal government. And I know the federal government's going to be reviewing it, and hopefully we'll have an answer in a very short time here.
Last question. From Abigail Women at
You realize you spent about $80 billion on
Hi, how you doing?
Hi, Premier. Thanks for taking my question. I'm wondering on the Pfizer delivery schedule, what's your reaction as to why Canada will be set back for a month while the EU will get back to their original delivery schedule by next week?
You chose to delay the shots by a month, so they said, fuck you, you're not listening.
Ontario's vaccination plan.
Well, I can't answer the conversation.
Yes, you can. You're a drug dealer just like they are, you fucking liar.
Question that the Prime Minister is going to have to answer, but the impact is huge. It goes, as the Minister said, it goes from 20% reduction up to 50%. That's going to be a massive, massive impact. And if you go back to the beginning of this, and this was our concern at the beginning, if anything were to happen, some people are criticizing why are we holding it back. That was the reason we're holding it back. You never know what's going to happen. It was a good decision by the Minister and General Hillier to do that. Do we wish we would have held back a little more? Sure we do.
You don't have records of everybody who vaccinated with the first shot.
Just ask the federal government, which I have
a little card that you write it on that you carry with you.
Really put pressure
you don't have those
on
anymore.
Pfizer right now, and why should someone jump ahead of Canada? And going back, if there's one thing that I wish we could have done,
buddy, you fucking chose to delay the shots. That's why.
Industry, pharmaceutical industry, we have here in Ontario, one of the largest in North America. You know something? We need to start making
I serve you up a kilo and you don't put it to the road,
happens again, rather than
all the fucking customers disappear. There was no point giving it to you. So you don't get the next one that you asked for. Somebody else does. It's that fucking simple. You know this, you fucking
there's no
drug dealer.
reason we shouldn't be able to have our own vaccine in the future. Thank you.
You do realize you keep cooperating with these white people to fuck niggers over. You're not going to be able to live in Rexdale, eh? I don't give a fuck where you're from or who your kids are. Leave the family alone. Whose rules are those?
Okay, thanks everyone.
Thank you, everyone. And again, thank you to the people of Vaughan, Alta, and the Mayor, Minister. This is an amazing, amazing hospital. Thank you. God bless.
And you've been listening in to Premier Doug Ford during his daily briefing in Vaughan this afternoon, where he unveiled Ontario's latest edition in the fight against the pandemic. We're going to go live to 680's Irene Precklin, who joins us with more on this historic announcement. Irene. And Sarah, it's being called Canada's first smart hospital, but Premier Ford says when it opens early next month, it's going to have a temporary shift in focus.
We've decided that Cordelucci Vaughan Hospital will open as a dedicated resource to support the province's COVID-19 response. This hospital will take in critical care patients from surrounding hospitals to help ease capacity pressures around COVID-19.
And almost 1,600 people in the province are being treated in hospital with COVID-19, about a quarter of which are in the ICU. Toronto Hospital has been sending some patients as far away as Kingston and Niagara. Ontario is reporting 2,578 cases of COVID-19 today. You have to go back to January 1st to find a smaller daily increase. More than half of those cases are in Toronto and Peel. Reporting live, Irene Precklin, 680 News.
And as you heard during the briefing as well, now Toronto's top doctor has been calling for paid sick days for low-income and frontline workers. And the city's Board of Health has now decided it will go ahead and ask the province to implement that measure. 680's Moment Qureshi joining us live now with those details. Moment.
So here's what we know at this point, Steve. We know that the Board of Health just this afternoon passed their motions asking the province to step up and create those 10 paid sick days for frontline workers who can't afford to take time off work if they get ill because they don't have those type of benefits. But we just heard from the Premier just moments ago, asked about that, and don't expect it to happen. He says that under the Canada Safe Restart program, there was $1.1 billion offered up from the federal government for people to get money to if they need to stay home. One of the arguments against it, if that money takes too long to come, up to 2 weeks, if people who are working and living paycheck to paycheck just can't afford to take that time off, the Premier says maybe the program needs to be fixed, but he doesn't seem like he has any interest in creating those 10 paid sick days, thinking that it will duplicate what the federal government is doing. I'll have more coming up at 2 o'clock. Reporting live, I'm Owen Qureshi.
And coming up in 60 seconds, we'll check in with traffic and weather.
680 News Time, 1:50.
Your head says, make sound investments for the future. But your heart says, invest
Tell us
in
about the
sound system
CTP,
right now. With advice plus.
and then tell us how sophisticated a Land Rover Discovery is. Or not Discovery, what's it called? Defender, my bad.
There's different categories of the homes, and we really need to be looking at these new homes in a new way. We're living in new times, and it's not really just about infection prevention and control. It's about the quality of life as well. And the fact is that people are living a very long time, and so we are ending up with a lot of people who are our most vulnerable population, and they are in need of care.
Without a doubt, and before we get to some of the ideas for moving forward, just before we go there, let me ask you, the setup as it is right now, the way these homes were designed, a lot of them, 4 beds to a room. Was the thought affordability for families, and also that there was some chance for interaction and socialization amongst the residents?
The British colonial concept of forcing, since there's a certain percentage of people that are deviant and sociopaths, to be in the room while you're sleeping.
20 years ago, we were trying to remedy that with rebuilding the so-called D-beds at the time. So currently, the model is a resident home area, so a wing, and we call it a resident home area with usually 32 people, because that is the model that works operationally, and that is the funding that's provided. So of those 32 residents, many have a shared bedroom. So they share a bedroom and they share a washroom, and by washroom I mean a toilet and a sink. One sink, one toilet. And then there might be a few private bedrooms that also have their own toilet and sink. So those 32 residents share all the other facilities, including 1 tub room, 1 shower room for 32 people.
And obviously, in the light of the pandemic, that seems like a now sadly fatal error, right? I'm guessing that's where a lot of the transmission might occur between residents in these shared facilities, these bathrooms.
Yeah, but let's face it, the pandemic has made canyons out of cracks that were always there. So, 32 people sharing a shower, and we're talking about an aging population, a population that's incontinent, population that does have other issues, and so
if they're incontinent, they're using a bedpan,
mitigate
and therefore don't need that toilet.
Infection control, whether it's during this pandemic or during a season of influenza or another type of virus like Norwalk, we need to rethink those kinds of models. And yes, a lot of the decisions have been made because they're cost effective, or they work with the staffing model. But in the end, is it really cost effective?
Yeah, absolutely. Big question. So what is it we need to address? What do you think it is we need to do differently moving forward? I mean, obviously, this is what we're talking about, not a quick fix and a quick solution, but I think we do also, not only obviously do we need that in the pandemic, but we do need a total rethink and a generally better long-term plan when it comes to long-term care and how it's set up and how it's run.
Well, I think that, we really all need to work together on this. There's a lot of professionals that have
I think we need to work together. That's somebody. That's the right person. You need to work.
This type of design work for 30 years, and we have a lot of colleagues that are very passionate about serving the community of elders.
Yeah, all sex offenders are passionate about serving.
Has risen through the ranks, and has really built the country we live in. And so, I think that we need to, as professionals, work together with the people that are the policymakers, work together with the actual, frontline staff, the owners of many of these homes. I mean, there's a plethora of information out there, but it's a question of people working together. The design of senior living and long-term care work has never been, a glamorous type of design, but it's a very dedicated design. And I think there's knowledge out there. I mean, we've had, during this pandemic last year, we've had several forums with our colleagues, and we all say the same thing. Things need to change. We need to be heard, and we know a lot of the answers, but we need to be heard in order to design for the future.
Yeah, I'm glad you brought that up, because I was going to ask you about that, because that's another reason I found your story so intriguing. Did you go knock on the door of long-term care and of the health department of Ontario and say, hey, I've got some ideas here? Because this is, I think, exactly what we need, and as an example of some out-of-the-box thinking. I mean, talking to an interior designer, somebody who knows space and how to utilize and use space. So why not bring in somebody such as yourself with your expertise that could really maybe help in this situation?
Well, many of the owners and many of the organizations do. I mean, they have professional. I mean, it's not just about space planning. It's about knowing materials. It's about looking at, designing for a 25-year building. A lot of the spaces, that are out there right now, they're 25 years old. And so when you're designing for a timeless environment. You're designing for something that resembles home, something that feels like home, but something that performs for an acute care setting. And so that would be a home. It's professional at a high level. I mean, professional interior designers are accredited professionals who have education, and we continue our education in the chosen field. So, we need to be, we really need to be asked, and we will perform. I think that, again, it's a question of collaboration with architects, engineers, all of the other professionals. There's usually when we're involved in new builds, there is an umbrella of professionals, and everybody is looking at it with
knows that the architects go first and get the engineers to
just really fascinating. Erica, really appreciate you joining us this afternoon, lending your perspective, and we're going to continue to follow this with interest, obviously. Thank you so much again for today.
Thanks for reaching out.
No worries. Erica DeJock is the founder of Design Farm, and as you heard, she believes in some others. Interior designers should be involved, and it's time for a complete rethink when it comes to how we design these long-term care homes, not only for today, but into the future. We'll get a break. News update to 2 o'clock. That's next here on Global News Radio, 640 Toronto.
Let's face it, if you've lost your job, you have questions. But before you call an employment lawyer, go to the free pocketemploymentlawyer.ca. Answer a few simple questions to learn more about your employment rights. Go to pocketemploymentlawyer.ca.
Back in my day, we walked in the snow, uphill, both ways. Now we take
Street, with U.S. markets closed for Martin Luther King Jr. Day, so commodities are trading electronically. Right now, gold is up by $7, $18.36. Oil going the other way, it's down $27.100, $52.09 a barrel. The Canadian dollar is down $13.100, 78.38 cents U.S. The Bank of Canada is set to make an interest rate announcement on Wednesday because, you know what, there's not enough happening Wednesday. That's the same day that Joe Biden will be inaugurated. Our loonie very likely to be mentioned by the Bank of Canada because it has seen a fair bit of strength lately, although no change in interest rates expected with rates already near record lows. I'm Chris McCusker. This is 680 News.
Meeting up with a few friends and neighbors, getting together with colleagues after work, attending a friend's wedding, all seem harmless. But these are the types of things contributing to a significant spike in COVID-19 cases in Ontario. Community spread is making more and more people sick, threatening to overwhelm our hospitals and put all of us at risk. Vaccines will help protect us, but until they're widely available, we all need to follow public health advice and guidelines. That means staying home except for essential reasons, like buying groceries. Stay home, stay safe, save lives. Paid for by the Government of Ontario.
Hi,
I'm Adam, founder of NewBorrow.com, and I started our company after I got fed up with the mortgage loan process. Turns out,
Why are they allowed to charge $400 to apply for a mortgage and no one else is allowed to charge upfront money for a loan? So, one point in time, I forget what year or day this was, the Bank of Canada played a little game one day and spent $5 billion trading Canadian to US dollars back and forth to attempt to influence what the value of the Canadian dollar was against the US dollar. And they were unable to do it. $5 billion, they did not affect the change.
Brought to you by
One day of trading.
And Richmond Hill is cloudy -1. St. Catharines mostly sunny and +1. Downtown Toronto, cloudy sky, 1 degree. The News Watch never stops. 680 News is CFTR AM Toronto. It's 2 o'clock.
number 1 for breaking news, traffic, and weather. This is 680 News, Toronto.
Here are Steve Roberts and Sarah Parrott.
Well, good afternoon. This is Monday, the 18th of January.
Here's what's making news this hour. Hospitals struggle with an increase in COVID-19 patients. Ontario is about to have a dedicated pandemic hospital in Vaughan.
Frontline workers getting the Moderna vaccine at the Metro Toronto Convention Center.
I want to get the vaccination, do everything I can.
It's the first COVID vaccination clinic in Ontario run by a city.
Toronto Public Health approves a motion to ask the province to create paid sick days for frontline workers to help limit the spread of COVID-19.
People that are sick with COVID, they're getting the vaccine.
Already has a program, so it's not going to happen.
And we're waiting to go live to the City of Toronto's COVID briefing this afternoon. We will head there as soon as it gets underway. We have a lot of Leafs news to pass on as Toronto plays Winnipeg tonight, and the Raptors will host Doncic and the Mavs. Sports at 15.
U.S. markets are closed. The TSX up by 32 points, and shares in TC Energy still in the red, but off the lows for the day. Business at 26. 680 News Time, 2:01.
Time now for traffic and weather together on the ones, and with Toronto's most frequent traffic reports, here's Carrie Prunskis.
This report is brought to you by Queens Smith MBA in Toronto. We have a couple of new problems. Watch out for a stalled bus westbound on the 403 as you're approaching the 407 west of Winston Churchill. Left lane closed here. It's on the left shoulder. MTO crews are blocking that left lane though. So just a brief slowdown westbound 403 as you approach the 407. Northbound on the 427 on the ramp to Highway 7, the 2 left lanes are blocked. That's the other stalled vehicle. So that's why it's adding to those delays. Northbound 427 jammed from the 407 onto the Highway 7 ramp as you're forced into that long-term construction detour. On city streets, northbound on Pine Valley, north of Steeles, the left turn lane remains closed. That's for some ongoing repairs to the pole that was damaged in a collision. And just some construction on Mount Pleasant, south of Lawrence, the left lane closed both ways. Earn your MBA from Queen Smith School of Business right here in Toronto. Find out more at smithmbaintoronto.com.
We don't need them
with the forecast, here's Jill Taylor.
For wind chill -8 to about -4 for most of the day and into the evening are guaranteed high. +1, varying amounts of sun and cloud, a few flurries possible.
It must be the vehicle,
for the
and it must have working headlights, and it must be on at night.
Right now in downtown Toronto, we've got mostly cloudy sky. It's +1. 680 News Time, 2:03.
Ontario's 7-day average for new COVID cases down, but maybe no surprise given the COVID case count that we are looking at today. It comes, though, as the province is set to announce and has, in fact, announced its first pandemic-dedicated hospital. We will get to those details in a bit, but first...
Happening now, let's go live to the City of Toronto's COVID update.
All the events that transpired this past year and the public health measures now in place meant, of course, to stop the spread of COVID-19 and to save lives have had an impact on the mental health of many, many people. Many people have never experienced the kind of stress and anxiety they might be facing now because of the unique circumstances in which we've found ourselves for some period of time. But as we have said from this table and tried to say it as a city administration from the outset, the extraordinary stresses it has created for people, and any other time for that matter, make it okay to say you're not okay. This is something that you've heard Chief Peg say before. And that it is very important when you're feeling anxiety or stress that is beyond what you've experienced to reach out to someone and to share those thoughts with them.
Thanks for
I know
minimizing
it's incredibly difficult for so many
Every time
people
they
to be
say
so
what you're doing
isolated
to us is real,
right
these are
now,
the effects of it.
and that so many of the joys
No,
and
no,
supports
this is
that
the
we
worst you've ever
count
done.
on and to
Thanks.
some extent maybe even take for granted in everyday life are at present few and far between. So I want to reiterate the mental health supports we have available to residents of the City of Toronto through city services
Let's see
like
if I get this straight.
211.
You attack me every
and to
fucking
let people
day.
know that there are experienced
And
people
now I'm supposed to come to you and
dedicated
tell
to
you what
helping
you
you
did
get
today.
through these tough times and make sure you get the support that you need, and that no one should have to hesitate to access these services, and no one should have to go through this alone. It's worth repeating that we need much more mental health support, largely a part of the provincial healthcare system. And it is my hope that in the wake of the pandemic and all the lessons that we've learned from it, that one of the things that will happen is a renewed focus by all governments in investing in healthcare in all of its forms, but including in particular mental health and addictions, which have seen gross underinvestment for a very, very long time. We're working in many different ways to help the province roll out the COVID-19 vaccinations. The chief will have an update on our immunization clinic, which opened today, and which will help Toronto and the entire province write the clinical operations playbook for all large city-run immunization clinics, which will be operating across Toronto and hopefully around the province and hopefully here as soon as possible. And of course, once the vaccine is available. As anyone knows who may have been watching the NFL playoffs over the last few days, you need a good playbook. It is the only way to win. This immunization clinic playbook will be battle tested and will ensure in the coming months that we get the vaccines to people in large numbers when the supply is available, and to do it as well as we possibly can. Lessons will be learned, bugs will be worked out, so that as we move to literally vaccinate millions of people in just a few months' time and in a very short period of time, once we really get down to the large numbers, we will have the process required for such an unprecedented undertaking refined to the maximum possible extent. We are making progress now as part of an all-hands-on-deck effort to get the vaccine to our most vulnerable residents. On Friday, we completed the first round of vaccinations in all 87 long-term care homes in Toronto, a week ahead of the provincial deadline. This is amazing work done at wartime speed, as I call it, and it will make a difference in our fight against COVID-19. I want to thank all of those who helped make this possible, those at Toronto Public Health, at all of our city hospitals, our hospital partners, city staff, especially those city staff who work in our 10 city-owned and operated long-term care residences. And I want to pay tribute as well for all of these different things beyond Toronto Public Health to the work that is done by Chief Pegg and his immunization task force established some time ago to help with precisely these kinds of assignments. Also on Friday, we began vaccinating seniors in our homeless shelters. Unity Health Toronto ran a clinic to offer the COVID-19 Pfizer vaccine.
We have
to more than
seniors in our
50
homeless
senior
shelters,
residents
but
and more
that's
than
not the
20
problem.
staff at the city-operated Scarborough Village Residence Shelter site. This clinic is part of a pilot to vaccinate people experiencing homelessness, and staff at up to 4 shelter sites with support from the city's Shelter Support and Housing Administration, Toronto Public Health, and the Inner City Health Associates. This pilot, which operates under the province's vaccine framework, is prioritizing shelter sites with the highest population of seniors and people with a significant risk of a severe outcome were they to come down with COVID-19. All of these characteristics put these individuals in question at elevated risk, including their residence in a congregate setting. So their vaccination protects their health and helps to reduce the chance of outbreaks.
That's good, bro.
The purpose of this pilot as well, similar to the convention center, is to produce a playbook for clinic operations or shelter operations at clinics of this kind, so that people, when they proceed to do vaccinations in all shelters, for that matter across the province, have, again, had all of those experiences and processes and procedures battle tested. Also last Friday, University Health Network, UHN, ran a one-day clinic to vaccinate frontline workers at the city's COVID-19 recovery program for people experiencing homelessness. Up to 200 workers at this isolation site were offered their first dose of the Moderna COVID-19 vaccine.
How many of them
This site was selected as a priority site for the vaccine due to the direct role staff have in caring for vulnerable people affected by COVID-19 and through its connection to the University Health Network. As you may recall, both the Inner City Health Associates and UHN helped the city to establish this site, the first isolation of its kind in all of Canada last spring. The city is grateful to our partners who are running these vaccine clinics to help protect our most vulnerable residents and the frontline workers who care for it.
Remember when you teamed up with Coca-Cola to put TV
command
sets
call
in my
this morning, a call
school?
that we have every morning to oversee the management of the pandemic, I raised the issue of mandatory masks in common areas of apartment buildings and condos. The city was one of the first municipalities in Ontario to move forward with mandatory mask rules in businesses, on transit, and in shared spaces in private residential buildings. I've asked the staff to drill down into the complaints we have received about masks and face coverings not being worn in apartments and condos.
It's irrelevant if you turn the ventilation on.
For example, any really frequent addresses that come up where we have more than an average number of complaints, and to follow up with building owners who are responsible for putting these policies in place in each of their respective buildings. The bylaw, recommended by the medical officer of health and our city legal staff, requires building owners or operators to have a policy to ensure masks or face coverings are worn by individuals in the enclosed common spaces, such as the lobbies, the elevators, and the laundry rooms, and to post corresponding signage. We even created signage at the city hall for buildings to use and to post, and it is posted itself, the signage on the city's website, so it's easy for people to reproduce it, and many have done so. It is my hope that this review by city staff of where the complaints are coming from will ensure that this bylaw is continuing to be followed by building owners and individual residents. And I think the two go together here if we want this to be successful, particularly during the ongoing lockdown. I will look forward to reporting back on the results of that as time goes on. I would now like to ask Dr. Davila to give her report for today.
This is wartime speed, bro.
Thank you, Mayor Tory, and good afternoon. Today,
took
I'm
more
reporting
emphasizing
892 new cases of COVID-19. 491 people are in hospital.
Good.
113 are in the ICU.
Good. That way when
And
we
I
shoot
regret to
somebody,
tell
the
you
cops are more
that
likely
there
to
are
declare
two more
them dead
deaths
while they're still
to
breathing.
report.
Like 2 days ago.
There are 50 active
sitting Monday,
outbreaks
is
in
this Sunday?
long-term care homes and 12
Saturday
in
night,
retirement
Sunday night.
homes. This is important because we now know that the delivery schedule for the Pfizer vaccine has
Why are
been
you
slowed
spitting while you
by
talk?
the need to retool Pfizer's principal vaccine
I hate that
production
sound.
facility.
I fucking hate this. There's a category of
But as
white
the mayor
people
just
that
said,
spits every time they speak.
fortunately,
I fucking hate that
the first
sound.
round of vaccinations
You're the ones that
have
always
been
get in my
delivered in
face.
Toronto.
Guys better
all
just lean
87
forward, tilt their
long-term
face
care
up, and then
homes.
realize I'm 6'2", and fucking try to
Across
look down at me
Ontario,
up their nose.
the province has decided the
Well,
best course of action for now
Then they
is
can't
to
breathe, they can't
reallocate the
figure out why it's
available
'cause your
supply
neck
of
is bad.
vaccine to ensure
Right,
that it
Miss
is
Legal
provided
Aid?
to long-term care homes
I get spit
and
on by
high-risk
legal aid in the
retirement
fucking
homes,
courthouse.
and to deliver second doses to those who've received their first dose of vaccine.
That's not what you're
In my
supposed to
view,
do.
as a physician, this is a sensible strategy for the allocation of available vaccine given the circumstances.
Given the circumstances, which are
But on
that
a
the
personal
vaccine's not
level,
available because
I
you
can
decided to do it that
understand
way.
how people feel.
Remember that. Circular
about
reasoning.
news
As
like
a
this.
physician, I'm particularly good at,
Everyone wants their turn.
systems management, mathematics.
So as your doctor,
models, and
I would say this
logistics.
to you,
You're excellent at logistics. You can't pronounce
patient.
it properly, but
and stay optimistic.
and stay
There is
optimistic.
good reason for both.
Stop spitting on the microphone, you
While we
Lord.
want the flow of vaccine to be swift, uninterrupted, and high volume, the fact of the matter is that this is the first time a vaccination campaign on this scale
Add up all the
has ever been
vaccines,
designed
approved or not approved, and
and
their production
implemented.
capacity for those
and the
companies.
whole
And
world
you cannot,
needs their share of vaccines.
vaccinate the
Public
whole
health
world.
has years of experience in the delivery of mass
It's going to take
vaccination programs.
3,000. What did I say?
And from experience, I can tell you that even with the best plans,
It's going to take
there are
3,000 weeks
bumps
in the
along the
Toronto
road.
area. 3,000
We
weeks.
should
50
all
years.
prepare ourselves mentally and emotionally for those bumps. But bumps will not alter the determination to get those vaccinations in arms. My understanding is that the deliveries of Pfizer vaccine
bloodstream.
are expected to catch up through February and through March.
Expected to.
Additionally, Health Canada is reviewing data on the AstraZeneca,
you don't know when your next shipment's
and
coming.
the Johnson & Johnson vaccine.
You got a 60-day ahead.
And the federal health minister said recently that a decision on the AstraZeneca Oxford vaccine is in the near future. So please, be patient, be optimistic,
Remember,
and
we
let
made an
me
88 million dose deal with
be
Pfizer first.
determined.
Because you let
While
Justin
vaccines
arrange the
arrive
drug deal.
and vaccines are delivered, we've still got to protect ourselves from COVID-19 because it is still circulating and will continue to circulate.
Forever.
But with those efforts,
What
what will happen is that the case counts will decline. In Toronto, we're already seeing signs of how we ourselves are truly the best defense against
You
spread
said
of the
we
virus.
3 times.
Anecdotally, over the weekend, when I was out walking, I saw that the significant majority of people on the streets were masked.
So?
This said to me that people were taking control and making decisions to protect themselves and reduce spread. And I was delighted to see it.
I was delighted.
Additionally, as you know, Toronto Public Health is able to analyze non-identifying cell phone data. One measure we look at is data that reflects how much time people are spending at home.
If you have an Apple phone.
Time at home measures were high last March,
Remember, these
and then
people can't
decreased
deliver an
over
Amber
the summer
alert, an
during
emergency
reopening.
alert, a silver alert.
We saw modest increases in time at home following additional measures put in place in October and November. Interestingly, the most recent data for January 3rd through to the 9th shows time at home at 82%. In March of last year, it was 87%.
That's not a change, you fucking retard.
This suggests that the lockdown from December 26th has had some impact on movement in Toronto. It is early going,
numbers
but if it
ran to
holds,
85.
then over time, decreases in case counts and hospitalizations should begin to emerge. It can happen.
Why didn't you go from the 2nd to
If
the
we are
8th to the
determined
1st to the 7th?
to stay at home and apart from people we don't live with for the short
the 4th
term.
to the 10th would have been a week. You started on Sunday and ended
Imagine
on
a
Saturday.
city not so many months from now
Not so many.
where we are all vaccinated, but where COVID is at low levels.
You're infantile.
While we
You're
get there.
patronizing. Not so many
can
months.
get
How many
there.
sleeps?
So let's.
Sound
With
it out. Does
I'll
anybody
hand
know what
it
that
over
means?
to Chief Peg to deliver his
I used to hear
remarks
people
for
scream
today.
that at the Sound it out.
Thank you, Dr.
What's that
Davila,
mean?
and good
I
afternoon.
started asking people what that meant.
Today
and
is
they
an
stopped
important
saying
day
it. They
in
used
our
to say it all
continuing
the time.
fight against COVID-19. Earlier this morning, our first non-hospital operated COVID-19 immunization clinic began operations inside the Metro Toronto Convention Centre
How fucking
as part of
stupid
a
are
proof
you?
of concept exercise.
Let's get the
A
whole
sample
public
group of
coming through
healthcare
here.
workers
That'll
has
help
been
us.
receiving vaccines this morning. As a reminder,
You know
at
what
this
ISO
point, this clinic is
9001
open by
means?
appointment only and is not able to accept walk-in clients, nor those who do not have a confirmed appointment.
So you've been telling us
The
about
city
this
of
for 2
Toronto was
weeks, and
asked by
today
the
you tell us
province
it's
of
not for the
Ontario
public.
to accelerate the launch of this first clinic in order to test and validate all aspects of the clinic operations plan. As part of the proof of concept work, our teams are validating the registration lists and schedules that have been assembled for this initial clinic. Yesterday afternoon, we understood that there were potential issues with respect to the initial registration process for this clinic, including some registering who may not fall into the prioritization framework.
Then how did they
We are in the
register?
process of reviewing these issues
completely negated
in order
the
to
purpose of
ensure
registering.
that we
Might as well
implement
just
any
give them a shot
necessary
and get them out of
changes
there.
moving forward. Should we
So
determine
who didn't
that there
qualify?
are in
Somebody
fact
you
people
laid off?
registered who do not qualify for vaccine at this time, we will contact those people directly. And we will remind everyone
It's like
that
you
the proof of
contacted everybody on
concept
the Metro
clinic's
Links
initial
bus.
clientele Our
with the
frontline
contact data
healthcare workers
on their
working in the
Festo
city
pass.
shelter system and in public health.
Do you see a cell
These
phone
proof
number
of
on here
concept
somewhere? 'Cause I
operations
don't.
provide us with an important and valuable opportunity to ensure that all aspects of clinic
Hey, what
operations
about Home Depot?
are ready for
You
wide-scale
can
deployment
stand within 2
when
meters
vaccine
of the guy as
becomes
long as it's
widely
less than
available.
15 minutes. Remember
As
that?
Mayor
Chief
Tory
Dave?
explained, an important outcome of this work will be the creation of a clinic operations playbook that will ensure that we are ready to open a wider network of clinics across Toronto once vaccine supply allows. This completed
What you
playbook will be
won't until you
provided to our
start doing it how
provincial
the
partners
manufacturer
for their
said.
use as well. At present, this clinic is operating on the basis of administering 250 vaccinations per day,
One
while we
bottle.
operate in proof of concept mode. This is only 10% of the
Proof of
planned
concept
clinic
mode.
capacity
What does that
of
mean?
more
You're only
than
doing it to prove it, but
2,500
theoretically
doses per day, which we expect to
So every time
deliver
there's a
once the
deviation,
clinic
they
is
won't write that
operating
down.
normally. We are initially operating this clinic at this scaled back capacity in direct response to available vaccine. The procurement and supply of COVID-19 vaccine is the responsibility of the
You're
federal
gonna slow
government,
down the
who then
process.
distributes vaccine provincially. The province of Ontario then allocates vaccines for local
These are the people
administration
that lose $1 million
based on
a
available
week with the
vaccine supply
exclusive license
and
to
in
sell
accordance
weed.
with their prioritized vaccine
They lose
distribution
$1 million
framework.
a week the last 2 years.
We were all disappointed to learn that the delivery of Pfizer vaccine to Canada
No, we won't.
is expected to be delayed as a result of manufacturing delays in Europe.
No. We
As a
told you what
result,
they would do if you
we have now
changed
been
the
advised
routine
by
that
the
they
province that we will only be able to
specified.
operate this proof
And
of
then you
concept
said you were going to do this,
for an
and
initial
this is
5
what's going to happen if
days
you do that, and they
due
did
to
it.
the lack of availability of COVID-19 vaccine. Accordingly, we are required to pause clinic operations at the Metro Toronto Convention Centre site at the end of day on Friday, January 22nd. Anyone who successfully scheduled an appointment to receive their first dose in the Metro Toronto Convention Centre clinic beyond this Friday will be advised directly. But those with appointments on January 23rd or after
You don't have a
should
phone
plan their
number?
appointment
This is
being
your
canceled
name.
until
Same
further
fucking
notice.
idiots.
There will be no impacts to second
We're
dose
going to
availability,
vaccinate
and we will ensure
1,250
that
people.
everyone who
Maybe.
receives their first dose before the pause of operations also receives their second dose within the permitted timeframes. Of course,
you
we look
won't. You
forward to
change it to
resuming
28
clinic
to 42
operations
days.
as very soon as we're able to do so, as advised
They
by our
said they
provincial
changed it back,
partners.
but they won't
We are
repeat that.
continuing to explore all options to accelerate our ability to administer vaccines to Toronto residents once larger quantities of vaccine are available. This will include planning for extended hours of clinic operations, expanded clinic capacity targets, and implementing innovative delivery methods that meet the needs of our city, including mobile vaccine clinics, priority neighborhood response, hospital-led clinic operations, and widespread public access via pharmacies and primary care physicians. Everything we have done in responding to COVID-19 in Toronto has been fully scalable, from the design and operation of the COVID-19 incident management system to the operation of this and every other vaccination clinic
I
that
don't think
we
you
are
know what
planning for.
scalable means.
This clinic, as with all the clinics we will operate, has been specifically designed and operated to protect all aspects of infection, prevention, and control, commonly known as IPAC.
To protect all
Finally,
aspects of it.
The enforcement of public health-related regulations has been a priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations related to COVID-19.
Why are you handing out warnings?
The city has taken formal enforcement actions 1,965 times to date. As a
You got
result of
2,000
violations of
calls
the
from last
Reopening
week.
Ontario Act, 10 charges were laid and 12 notices were issued against owners and operators of retail
handed out
stores,
more warnings
linen
than
and
fucking
houseware stores, beauty supply and nail salons, and a hookah lounge. Enforcement staff also conducted 146 proactive inspections this weekend
What the fuck's a
of
hookah lounge
restaurants and
anymore? You
bars
can't smoke
with no
inside
tickets
anymore.
being issued.
What is a hookah lounge?
Additionally,
41 charges were laid as a result of large gatherings on private property.
Hey, remember
This
the
included a
bylaws that
gaming
you have to have
house
a separate
and
ventilated
gatherings
room
in
and
private
shop.
residences.
Hey, you know the feds, if you're federally
Toronto police
registered,
also
you must have
responded
a
to a
separate
number of
ventilated
protests,
smoking room.
resulting in 20
Hey, you're the
charges
fire
being laid
chief.
under the
Why don't
Emergency
you enforce
Management
the
and
fire
Civil
code?
Protection Act, and 4 charges being laid under the Criminal Code.
What?
Thank you for your continued support
What
and
charges
patience
were those?
as we all do our very best to put COVID-19 behind us.
I've got like
Please
8 charges.
continue to monitor
criminal
toronto.ca/COVID-19 for the
that
most
means nothing
accurate
to
and
do with
up-to-date information in our city. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to reporters to please unmute yourselves. If you're using a phone, you can do that via *66. Also, any questions related to enforcement, Inspector Matt Moyer from the Toronto Police Services on the line, as well as Carlton Grant from Municipal Licensing and Standards. Our first question is to Ashley McGuinness from News Talk 1010. Go ahead, Ashley.
And then I hit it again. And
Hi, thank you so much for taking my question.
Oh,
Dr.
goodness,
Davila, you just explained how encouraging it is to see the time at home data increase for the first week of January. Do you think sharing encouraging data like that more often will help show people that their actions are making a difference and that life doesn't have to be like this forever? And Mayor Tory, I'd love your input on this as well. Well, I think I certainly hope so. We would like to encourage people and show that they can make a difference. And in fact, we know that they can do this because we've had this experience in the spring. We saw when people stayed home that we were effectively able to reduce the spread of COVID-19 in the city. We understand, how the virus spreads and how social interaction actually facilitates that. So to the extent that people are able to heed the advice, practice those self-protection measures that we've talked about so often, watching distance, wearing your mask, washing your hands, staying home when you're sick, the more people are able to do this, the more we will be able to reduce the spread of the virus. And as vaccines become available over time, we have that extra tool this time around relative to the spring. So I am hopeful about that and hopeful that people appreciate that it does make a difference.
You only do that in the black neighborhoods.
I really think this kind of information is going to help us to encourage people to continue to do the right thing. I hadn't thought of the ability we have because we've been disclosing this data on kind of a top level basis, but I've now asked as well that the people who supply it break it down by day of the week, hour of the day, part of the city, so that we can see kind of where people are doing a really great job. And similarly, I've asked for traffic data, which in all of these bits of information come a little bit late because they have to sort of collect it and then find a way to present it to us. But the traffic data I'll get about once a week, and we'll share it publicly. But what it showed in the spring, for example, was we got down to about half in that range of the normal traffic levels, and then it rose back up to about 85% in the sort of late summer, fall period, and had dropped down only to about 70% by the end of the year at the sort of Christmas period. So I think, what we hopefully will see is as January unfolds further and the stay-at-home order took hold, that the traffic levels will further drop, and it's not a ironclad indication of whether people are doing what they've been asked to do, and in some cases required to do, but it certainly is some indication of compliance, and I hope we can use it as a positive encouragement for people to keep up the good work, so it'll get us through this dark tunnel that we're in and out to the other end where the vaccinations are available to millions of people.
What happened to your traffic special agents? I haven't seen one yet.
Thank you, and I don't want to get too ahead of myself, but I do think it is important to have things on the horizon that we can count on and look forward to. So if we stay on the right track and get a lot of shots into arms, bring cases way down for spring and summer, is the city working on plans in order to give a boost to the local economy, local businesses, what can business owners look forward to later this year?
I can respond to that simply by saying yes. We had some plans that were ready to stimulate people's attendance and patronizing of restaurants. We had sort of shop local campaigns, events that were going to happen in the different neighborhood main streets.
Why do you hand out aluminum screens to crackheads when stainless steel ones are
health restrictions in the fall? It made no sense to be running those kinds of campaigns, and we were doing them through the VIAs, through Destination Toronto, which is the tourism development agency in the city. With business, we're all working together on that, and I can only tell you that a lot of those things, the plans are actually ready. They can be modified for the fact that 6 or 8 months have passed, but the answer is yes, there will be initiatives undertaken to help get the city back on its feet, to help infuse that spirit of can-do into the city. And all we can do is both keep our fingers crossed, but more importantly, follow public health advice in the meantime.
In Nova Scotia, they try harvesting my organs. My soul will be laughing my ass off, and everybody you put an organ into dies from sickling of the blood.
The time to look at some of these kinds of programs. Okay, thank you. We'll go next to Mark McAllister from City TV. Mark?
Oh, he's changed the subject so much.
Thank you. I hope you can hear me okay.
We can, yes, go ahead.
Dr. Davila, if you could further the information on the time at home data that you received from mobile devices. You said we've reached 82% compared to the 87% in March. Did you have a particular goal in mind? Do you want to get to that 87% or higher?
On what?
So, Mark, really what we're trying to do is to get to the level where we're effectively staying at home and seeing the results of that reflected in COVID-19 case rates. So,
which has nothing to do with aggregate data he was just talking about.
People to stay at home where they can. We know that not everybody can work remotely. It's not a possibility for all of us, but to the extent that we're able to facilitate the ability for people to stay at home and only go out for those most essential of needs, the grocery shopping, the pharmacy, healthcare, and exercise, then we know that we'll have less interaction between people and reduced COVID-19 rates as a result, while vaccine comes on board and helps us in our toolkit against this disease.
And you've been listening to the City of Toronto briefing here on 680 News. We will have details on what the mayor had to say, along with Dr. Davila, coming up in just moments. For Sarah Parrott, I'm Steve Roberts. Have yourself a great afternoon. It's 2:30.
What the fuck is 680 News? That really solves things during. There is not one expert. Everybody stops. Everybody knows this. Don't.
Oh, who is actually behind a lot of these companies? And we don't know in a lot of cases where the money is coming from. And Canada has a very bad reputation when it comes to this because it hasn't closed the loopholes where that kind of information is publicly available, where you should be able to find out who is actually buying up these beds and who is actually investing this money. And you can't find out because we have these layers of companies and partnerships going on and literally no public information about it. And then add to that a very weak inspection branch, which, another news report said 88% of facilities haven't been able to meet the requirements of the Long-Term Care Homes Act. Add all of that together, and I think you've got a real debacle in the making, and I think that's exactly what we've seen.
So what is your recommendations, your organization's recommendations coming out of this research? Do we have to get profit out of long-term care? Do profit in public health, public safety, do they just not mix?
I couldn't agree more. Public health and public safety don't mix with for-profit provision of care by large corporate chains. And I think there have been various reports that have already shown that.
Park Lawn. Onto the Highway 7 ramp. You had a problem recently clear on the ramp to Highway 7, and with that long-term construction going on, it's still quite heavy. And MTO reporting a problem on the southbound 427 at Highway 7, the right lane blocked because of a stalled vehicle, so watch out for that. Delays aren't too bad on that side of the 427. A smooth drive on the 401 in both directions. The Don Valley Parkway looks good north and south.
Des 60 ou 70 dernières années, là, une bonne partie du 20e siècle sur le monde, étant donné que la Chine est un pouvoir autoritaire, évidemment, on ne parle pas de liberté de presse, on ne parle pas de véritable liberté des individus. En Chine, on l'a vu à la lumière de la pandémie, l'information ne circule pas très bien. Est-ce qu'on doit craindre ce pouvoir de la Chine, Rome Chantal?
Oui et non. On doit craindre ce pouvoir si, par exemple, les autres grandes puissances mondiales ne sont pas prêtes à accepter ce rôle déterminant. Il y a des penseurs américains, des universitaires comme John Mearsheimer, que vous connaissez très bien à Montréal, qui ont appelé à une guerre entre la Chine et les États-Unis pour donc prévenir son attention. Donc, Et on se place dans cette perspective-là.
Have you seen the Russian and Chinese war games?
Have to hope that because of all of the people who've died tragically during this pandemic, that finally government is waking up to its responsibilities, and I sincerely hope
Tragically,
that
they've
at least
died.
national standards will come in that will say that there needs to be an emphasis on community care and community residential and in-home support for people that's delivered by not-for-profits without that loophole that's there right now that allows hospitals, for example, to bypass that provision in the Canada Health Act by contracting out to for-profits. That loophole has got to be stopped.
All right, well,
because everybody goes to a long-term care home by going through a hospital.
I'm sure we'll talk down the road.
Great, thank you so much.
Be well. Dr. Patricia Spindell, co-founder of Seniors for Social Action Ontario. And we're back after this on Global News Radio.
At Toyota, safety.
What are the odds they both be the same level of stupid, the same flavor of stupid?
There have been no major delays so far in shipments of the Moderna vaccine. The federal health minister currently reviewing the AstraZeneca, Oxford, and the Johnson & Johnson vaccines for possible approval. So far, 209,788 doses of COVID-19 vaccines have been administered in this province, with over 21,000 total vaccinations completed. Reporting live, I'm Kate Lumley.
209,000 doses. Vaccinated 21,000 people.
Turning
What?
the Metro Toronto Convention Center into a site for these mass vaccinations. The clinic, though, won't be able to stay open much longer than this week. Six Cities' Mark Douglas is there and joins us live with what we know. Here's Mark.
So, Janet, this was the first, or still is the first day in the process that was supposed to see over 5,000 City of Toronto frontline workers getting their COVID vaccination over the next 6 weeks. But the city has just announced that due to the production disruption for the Pfizer vaccine, this clinic here at the Metro Toronto Convention Center will have to close on Friday after only 5 days. This man who works in the shelter system was one of the first of the city workers to be vaccinated here today.
Got stabbed yesterday.
And why is it that you wanted to get the shot today?
Mainly see my family and basically feel safer being around people.
The Fire Chief Matthew Pegg, leading the city's immunization task force, points out how truly critical the success of this clinic really is, because it's a proof of concept operation, and this is going to be a model for how every city-run clinic in Ontario is eventually going to be.
We are looking at not only the design and the setup and the operation, but all of the technology, all of the registration, everything to do with clinic operations.
You're still using syringes.
One end to the, I guess, from
They're called
all the way through
insulin
to
syringes.
completion.
You know, people who take
Even
insulin
though
don't
it's
use those
going to close
syringes
5
anymore.
weeks early, this clinic is still aiming to vaccinate 250 frontline workers per day with the Moderna shot, and it'll be able to handle 2,500 per day.
Hey, remember when Oxy-Neo was going to solve the opiate
Reporting live
crisis?
outside the Metro Toronto Convention Center, I'm Mark Douglas.
Meanwhile, out west, Alberta Premier Jason Kenney says the province is putting a pause on administering the first doses because of the uncertainty about when more will start arriving. The stoppage is to ensure
That's
they won't
why
have to
they're not
cancel
giving you
second
more,
dose appointments.
stupid.
Kenney says he's confident they'll be administering within the recommended time frame. So far in Alberta, health officials have given out 90,000 doses.
It's great that we've been able to vaccinate so many, but we have quite simply run out of supply. Yes, we'll get more vaccine in the coming weeks and some more doses this week, but we need to make adjustments today to accommodate this lack of supply.
Premier Kenney says he's deeply disappointed by Pfizer's decision to cut back on promised deliveries of vaccine to Canada over the next 4 weeks.
This is 6 City News. The province has announced a new hospital resource to help manage capacity, as hospitals already busy with traditional cases of illnesses and accidents now struggle to balance an increase in patients with COVID-19. 6 Cities' Irene Preckler joins us live with the latest on that, as well as today's new case numbers. Irene.
Slajana, when the Cordalucci Vaughan Hospital opens next month, Canada's first smart hospital will temporarily focus on helping ease the COVID-19 burden on other hospitals. Premier Ford says the hospital adds 185 beds, including 35 critical care ones.
And this is going to make a massive difference with capacity.
And hospitalizations remain high, almost 1,600 COVID-19 patients being treated in Ontario hospitals, about a quarter of which are in the ICU. The ER at the new hospital in Vaughan won't open until the pandemic surge is over. Ontario is reporting 2,578 new cases of COVID-19 today, and 24 more deaths linked to the virus. It's the lowest daily increase in new
cases since January
So you're
1st, and the lowest number of deaths so far
go
this
to the
month. Reporting
hospital,
live, Irene Preckless,
sit there
680
3
News.
days and then get transferred back up to.
This is 680 News pushing the province for paid sick leave on the agenda for today's Toronto Board of Health meeting. 680's Will McCray, she's following along and joins us live. Moment.
That's right, James. The Board of Health did approve a motion asking the province to create those 10 paid sick days for frontline workers who can't afford to take time off.
The city council does. Spend all day and week arguing over what to ask from.
80 to 90% of individuals who are low-income workers do not have access to paid sick leave. We're not going to be able to beat this
pandemic. Does the law say that or not? Just making a new law is not going to fix that. It's
until we address this very critical and very important policy gap.
The concern there, of course, is that people who are feeling sick instead of staying home because they can't afford to would end up going to work and could potentially spread COVID-19 if they have the virus. Premier Ford says it's something he wants to do because the federal government already has a program.
If people don't feel they're getting it quick enough, which I've brought to the attention of the Prime Minister and Deputy Prime Minister, then we need to change the program. If they need to top it up a little more because $500 a week isn't feasible, then we change it. But let's be very, very clear. There's no reason for the province to jump in there when less than 27% of the overall program hasn't been taken up.
Reporting live, I'm Owen Brashy.
That's the
Gas prices are next.
Listen 3, 4, 5 times a day on your radio, on our mobile app, and on your smart speaker.
Play 680 News. So, our mortgage approval is done?
Great news. The bank has approved you at a 1.79% rate.
What the what? That's way too high. Butler Mortgage is 1.38%.
Well, it cannot be the same as our bank's mortgage.
It's
Donc voilà, ce sont ces mémoires. Au deuxième rang des lectures des Sud-Africains cette semaine, Aurélie, on trouve...
Oui, un roman intitulé Ikunga de Doudou Boussanier-Doubé, qui est une jeune romancière qui s'est lancée dans une saga...
So you just spent 10 minutes shitting on China. Now you're going to big up Africa.
Cases in Walmart.
Not mention China's working Africa.
400 cases in Amazon warehouses. But these are the places we're pushing more people while shutting down the small guys, where the government even admitted there was virtually no COVID transmission in Everett.
Dan, have you heard from your members? What are members of the Federation of Independent Business? What are they saying here today and this morning on the heels of this news from the weekend regarding the violations by big box stores when it comes to COVID protocols?
Well, I tweeted a video clip on the weekend of the big lineups outside a Costco location, and I got a load of comments about that. But they are raising the unfairness about the unlevel playing field that exists between large and small companies. There's some positive momentum, I will say. There are lots of good comments about the new Ontario Small Business Support Grant. That's been a helpful addition that we just launched. I think 10,000 businesses have applied for that. The credit to the government for finally getting around to providing some direct support to small businesses. But for goodness sake, businesses are desperate to replace subsidies with sales. We know this isn't business as usual. Small firms want to say if it's safe to buy something at a Walmart, then they should be able to buy it in a small firm with restrictions. If it's safe to buy the book on the big table with 200 other people breathing over your neck at Costco, it should be just as safe to go to the independent bookstore with a capacity limit and buy it there. That's what we're asking for.
All right, Dan, really appreciate the time as always. Thanks so much for joining us this afternoon.
Anytime at all.
All right, Dan Kelly is the head of the Canadian Federation of Independent Business. And when we come back, speaking of business and business news, some really encouraging news for workers at the Cami plant in Ingersoll. We've got details on a monster deal and renovation coming to the auto plant there. That's next. But first, a check. Speaking of automotive and cars, check on traffic. It's Global News Radio 640 Toronto traffic.
We've got some problems if you're leaving downtown on the Gardner westbound. Just before Park Lawn, we got stalled vehicles on both the left and right shoulders. Police, they're sitting in the right lane protecting these vehicles on the right shoulder.
They don't give a fuck if
Really
they're
heavy
making a
delays
Chevy
starting
or
to
a
develop,
Ford or a
getting out of
Dodge. They're getting
downtown,
paid,
almost all
right?
the way from about Jameson. 427
GM's gonna
northbound,
be coming
off
out with
ramp to
electric
Highway
delivery
7
vans,
from
which I think are
Hampton
stupid. I'm sure they think they're stupid too.
Southbound on Highway 7.
What I think is
There's
worse, a
stalled vehicle
Dodge
blocking the
delivery
right
van
lane.
that's front wheel
Now, State
drive.
Street
I don't
with
see an
that
axle on the
southbound
back
car
of these
lot blocked
trucks.
at Eastern. That's because of a serious collision
We also have a crash getting cleaned up in Vaughan at Jane and Rutherford. Now at Pizza Pizza, try the new superfood pizza crust. It's vegan, gluten-free, and made with antioxidant-rich vegetables like purple sweet potato. Now at Pizza Pizza. I'm Lori Turkell with Global News Radio 640 Toronto Chopper Traffic.
Can Malcolm Bryant
Remember your killer's name?
confront the deadliest of
Oh, that's
demons?
nigger speak. We're gonna yam that yam.
Prodigal Son, Wednesday on Global.
At Toyota, safety isn't optional. That's why our vehicles come with Toyota Safety Sense Standard. It's a suite of intelligent safety features that other car companies charge extra for. That's like buying bubble wrap and paying extra for the air in the bubbles. Lisa 2020 every
Somebody approved that.
.ca/advice.
It was an exciting night for Nissan at the award season sales event.
One lucky driver took home best-in-class fuel economy in the Nissan Kicks.
I just want to thank Intelligent Emergency Braking for giving me my big break and zero gravity seats. We're always
Finance a Kicks SR from 0% for up to 84 months. Plus, get a set of winter tires at no charge and a $500 trade-up bonus.
Visit Nissan.ca or
So that intelligent emergency braking thing came out in the 90s on Mercedes because they studied and found that most people in an emergency situation, they put their foot on the brake and then they lift it back off. And then after the collision's already over, because it takes you're mad. Because it takes 1.4 seconds or some shit. Then they push their foot all the way down. So when it bends, if you push your foot down suddenly on the brake, the pedal goes all the way to the floor on its own. It's not a Nissan invention.
The system we've used is outlined in our book, Income for Life for Canadians, which sells on Amazon. But you can get your free copy at freerealestatebook.com. Free, no strings attached. Just go to freerealestatebook.com.
Nano Nation is pleased to introduce a Health Canada approved hospital grade persistent protection system to help businesses keep staff and customers safe. Nano Nation uses a two-step process.
These are Health Canada approved matches. This is a Health Canada approved book.
We apply our Health Canada
Health Canada approves of this
all
is weed
surfaces,
packaging.
including high
That's
traffic
retarded
and
what
hard to
you just
reach
said.
areas, which effectively cleanses with a multi-spectrum 99.9% hospital grade disinfectant. We then finish
That's
with
not a
our
disinfectant.
BioProtect solution, a
99.9% is
persistent cutting-edge
sanitized.
technology surface
You
coating
need to
that kills
sterilize. You
on
didn't
contact
disinfect it. There's
bacteria,
still 1 out of
mold,
1,000
fungus,
bacteria.
and other microbes.
What about
It is proven and
viruses?
safety tested. One application will protect your staff and customers for up to 90 days.
Ever.
Hello, I'm
That's
Dr. Ray
bullshit.
Tigley, Chief Medical Officer of Nano Nation. Let Nano Nation help keep everyone safe and your businesses moving forward.
For more information, visit
Medical Officer.
nanonationcanada.com.
Stop the spread. COVID-19 can be deadly. The time to act is now. Everyone must do their part to stop the spread of COVID-19. Stay at home. Period. Full stop. Only go out if absolutely necessary. That means for groceries, for medications, for medical appointments, or if you provide an
I would
essential
like to know the
service.
real estate
Protect
transaction
yourself and
deals that
others.
got this
Stay
company,
home.
Chorus.
For information, visit ontario.ca/coronavirus. Paid for by the Government of Ontario.
In life, the most important question
Remember when
anyone
City
could
Hall's
ever
biggest
ask
focus
is,
was getting
would
rid
you
of the
marry
Captain
me?
John's floating restaurant? Wow,
Are
that
we
was
alone
so
in the
important.
universe?
Well,
Or how does a brain name itself?
Okay, point taken. The most important question anyone could ask when they're in love and want to be with that person forever is, will you marry me? Make sure it's a yes. With Spence Diamonds, Canada's engagement destination, with thousands of rings to choose from. Spence Diamonds, open for virtual appointments and curbside pickup.
Hey, it's Sangeeta Patel from ET Canada here. I'm a firm believer in the power of sleep. So last year I decided to meet with a sleep country expert who took the time to find the perfect bed and pillow for me. See, I love my lifestyle adjustable bed. I can set my favorite sleep and massage positions easily with an app on my phone, and I wake up refreshed after a great night's sleep.
For a limited time, buy any adjustable base and get 15% back on a Sleep Country promo card. Restrictions apply. See in store or online for details.
Tis the season to look great and save big. During the Hakeem Optical Winter Sale, save 60% on all Hakeem designer frames, lenses, and all coatings when you purchase 2 pair of complete prescription eyeglasses. Give the gift of good vision to someone you love with Hakeem Optical gift cards, available in amounts of $50, $100, and $250. Hakeem Optical is always saving you money on fashionable eyewear.
Your eyes can have it all.
I wrote the gift card. I didn't even know what it was. completely arbitrary.
You're listening to Jeff MacArthur on Global News Radio 640 Toronto.
Monday, 18th of January. This is known as Blue Monday, which isn't a real thing, which is something that was dreamt up by some travel organization that back pre-pandemic would make us want to buy airline tickets and go away somewhere.
It didn't work
But
that
the
either.
news today,
Actually,
anything
the
but
media
a
was the
downer
biggest
for
proponent of
Canadian
that.
auto workers.
Blue Monday is this and it's that, it's this and it's that, proven by this and that.
$1 billion.
I still don't know what the
That's what it
name
would be. $1 billion renovation to the Cami Automotive Plant in Ingersoll. And joining us now with all the details is Unifor President Jerry Dias. He joins us here on Global News Radio 640 Toronto. Hey, Jerry, good afternoon.
So we can apply for
Always good to talk to you, Jeff. How are you today?
I'm well. Thanks. Good to talk with you. And congratulations. Tell us about this monster deal.
Was it CLGM?
Well, it's been quite a while in the working. It really is about stabilizing the footprint, and it's about, watching the change in the industry as it's heading from ICE, internal combustible engines to battery electric vehicles.
That's not what's changing.
And what we're doing at Cami is going to be an incredible home run. It really will be about building large commercial vans for the Amazons, the DHLs, the Perlators, the FedExes, because that's where the industry is heading, and that's where, frankly, consumers' demands are. So this is going to be a minimum of a 10-year commitment. We're hoping that it'll start to create even more jobs.
Amazon, I got some shit I need to ship.
At the end of 2023, no, we don't do that. But our numbers just ratified by 91%. They're feeling awfully good about it, and frankly, so am I.
All right, tell us a bit about what's going to happen at the plant. $1 billion.
No work or
That's
work.
No small
91%.
Does the entire Cami plant, does it have to be retooled, Jerry, to build electric vehicles?
No, because for the next 3 years, we're going to continue to build Equinoxes as well.
That's not. Whoa, that wasn't an answer to his question, but you did just tell us $1 billion renovation.
Will be in full production by February.
They didn't say retooling, they said renovation.
Next year. So, things are going to be fine. They're not going to have to spend $1 billion, frankly, on twinning the assembly line because in the beginning it'll be quite manual. But the $1 billion is going to be about, we're going to have to modify the paint shop. We're definitely going to have to modify the plant. And obviously there's the money that's going to be spent
we don't, but we do.
The changing technology. So it is a huge win for our members. And like I said, it's great for the community of Ingersoll. People need a lift during today's times.
The paint has to be reprogrammed to stick to a different shaped piece of metal, right?
I was about to ask you about that because Ingersoll is such a great city, such a great town, great area. Tell us about how big of an announcement this is for Ingersoll and for auto workers.
As big as when they said we were going to get a mailbox.
Supply base out of Ingersoll, and you've got a much different community. Cami really is the financial blood of that community. I mean, obviously it's a farming community as well. Obviously. But this is huge. And the good thing about it is
obviously
we have probably about 25-30% of our members today that are retirement eligible. So this is jobs for young people. This is going to be young people which will be starting in the facilities that can now look to starting a family, know that they're going to have incredible security. I'm receiving all kinds of emails from members that have been there for 20 years. And this collective sigh, knowing that this program is for at least 10 years. And what that means they can get to the end of their working life with a decent pension. And so there's a really, really good mood happening around Ingersoll today. And like I said, people have a lot to be happy about.
All right, tell us a bit, too, about big picture here, because this announcement for Cami and Ingersoll to build this all-electric commercial van. I mean, it comes on the heels of a big announcement. Ford here in Oakville retooling. They're going to build electric as well. It seems as if the Canadian auto sector is kind of on the cutting edge when it comes to electric vehicles and the way forward.
Well, 4 months ago, people were talking about the death of the industry.
We're at the front of the line for self-driving vehicles.
$1 billion later, people are looking at things a little different.
Volvo and Mercedes beat us.
In Canada. Globally, over $300 billion have been announced by the various OEMs.
And then China, where Silicon Valley fit in,
for electric vehicles, and not one nickel have been allocated to Canada. So now, after the negotiations with Ford, the commitment in Oakville, Fiat Chrysler, the commitment in Windsor, the reopening of Oshawa, obviously the electric vehicles that are now going to be in Canada. All of a sudden, nobody's looking at this as a sunset industry anymore. It's a sunrise industry. I'm speaking to a lot of the parts suppliers. They're saying, hey, hold on here. We're going to start to migrate. We're going to start to invest in battery electric vehicles. We see the changing environment. And more importantly, we see that the federal and provincial governments are in tune with this, which is an $80 billion a year sector. So Ontario is well positioned. And if you look at our raw materials, this is the first time, I will argue, Jeff, in a long time, we've talked about how do we utilize Canada's raw materials and natural resources to put Canadians to work. The key
by stopping producing what gets made from what's here and starting to use coltan and cobalt and all the things that come from Africa. You're a fucking genius, bro. Do you realize how bad you are at PR? You realize how fucking bad you are at your job?
Suppliers about
All this shit comes from Canada to build an electric car in
Ontario, and you'll be well rewarded, and people understand that.
All right, Jerry, listen, really appreciate the time with us on this
little
Monday
bigger
afternoon.
commie
Again,
frog in
congratulations
Congo
on the deal.
knows coltan comes from Congo. How do you not know that?
Jerry
And I
Dias,
still don't know why
president
you
of
have to use
Unifor,
that.
on this $1 billion
make a
deal
battery
with
with some copper,
GM
some
that'll
steel,
see
and
the
11
Ingersoll County
People
plant
coltan.
retrofitted and start building all electric commercial vehicles.
Hey, what about the
And that does it for our time on this Monday. Thanks as always for yours. I'm Jeff MacArthur. Have a great rest of the day. I'll see you tomorrow morning at 9 on the morning show on Global Television. And stand by for John Oakley next at 3 here on Global News Radio.
I'm Carlos Bustamante for ET Canada's Entertainment Minute. Justin Timberlake is a proud dad of 2.
Was chief of staff for
Is that a big
KPT.
age of it?
Business is next. Every week, 680 News advertisers get their message heard by 1.5 million listeners. Listeners who have money, own homes, drive cars, do their taxes.
I'm Mark Felstein of Mark Felstein and
Where does the
Associates.
per
And I'm
week
Sarah
come?
Felstein, the next generation,
I don't
and
know
we
what
run an
people
accounting
present
and tax
businesses
practice in
are.
Markham, Ontario.
We've been advertising on 680 News for the last 10 years.
Mark and Sarah Feldstein are smart investors.
It's a long-term investment, so when you invest in 680 News, you're investing in your long-term future of your business. But you have to be patient.
We did see results from 680 News
But you have
right
to be
away, but I
patient.
can say that
This
over
idiot's been
time,
advertising
those
25
results have
years and I
come
never
in
heard about it.
short and long-term results.
You're branding your name over long-term. We noticed that we're off 680 News during the Christmas break. We're still getting calls because of our branding and our
But
long-term.
then you tell the other joke about the sales go down. Let's get out 680.
Someone will say, oh, I recognize your business name. I heard you on 680
Somebody
News.
named you
Imagine
something that makes
1.5
money.
million
You
listeners
don't do
hearing your
anything.
ad every week.
You
Go to
use this. You don't need
680ads.com.
680 News Time, 256.
It's so successful at selling advertising. Every third ad is advertised with
Well,
those.
Jen, it was one of the big
Why
stories
would
on
you
Main
not just
Street
fill that
last
up
week.
with news?
Couche-Tard's $25 billion buyout of a French grocery chain called Carrefour, and just as fast as news of the deal came, the massive price tag left market analysts kind of scratching their heads a little bit. Well, now the deal is no more. The objections were largely linked to French national laws and a stand against the deal by France's finance minister. Couche-Tard says they do actually still hope to buy the French grocer one day, but for now their focus will turn to other deals. Couche-Tard shares fell 11% last week overall in reaction to this potential deal. But now that it's scrapped, it appears investors like that. Couche-Tard stock up right now by 1.5%. The TSX is higher as well. It's up by 37 points at the moment to 17,946. This is American markets are closed today for Martin Luther King Jr. Day. Wall Street benchmarks all start a shortened week tomorrow in the red. Lost
You know how
losing
hard it
more
was
than
getting those words out of his
0.5% in
mouth.
Friday's
Martin
session.
Luther King.
Well, Parler looks to be back online. It's the social media platform popular among conservatives and President Donald Trump supporters. Its website's back in action today. Really only barely. The only thing you can do or really see on the site is a message from the company's CEO that reads, "Hello world, is this thing on?" Parler was dropped offline by Amazon last week, in line with several social media channels that were censoring and or suspending President Donald Trump, sparking some heated conversations about free speech. Checking commodities trading online today in the shortened session. Gold is up $7.10, a 0.5% gain up to $1,837 the ounce. Oil just falling slightly in the other direction, is lower by 11 cents or 0.25% to $52.25 a barrel. We do have the loonie in the red at the moment as well. It's lost 0.1% right now at 78.42 cents US. And once again, if we take a look at the TSX, just a modest gain, up 0.25%, 17,947. At the Business Center, I'm Stuart McGinn.
We can sell $200 billion of arms to Saudi Arabia.
is on now.
don't pay for 90 days on
and
all
dump
new
30,000
cars,
liters of milk
OAC,
down the
and no
drain
charge
and
all
send a
drive on
plane of
select
toys to Lebanon.
Frontline
That's
workers
good.
receive 2% above
Put a
invoice
toy
pricing
shovel in the
on
toy
all
bucket
new
to dig
cars in
themselves up.
stock. Your safety is our number one priority. We have masks and gloves ready for you. Looking for a Hyundai? I'm your guy.
By the way, why wasn't
Visit
Canada trying to buy that fertilizer? We're growing tropical
Three
plants and
locations to serve
fucking
you.
rich.
So, how's your blood pressure? Pretty good? What if I said fixed or variable? 3 years or plus? 10, 25%, or maybe no down payment at all? Self-employed, bad